Hello friends, welcome to my channel called Med Recall by Dr. Sonali. Today we are going to learn about epiphysis and its types. Okay. So before going to our topic, let's see what is our today's good thought. It is, if you believe in yourself, anything is possible. So let's start with epiphysis. In previous lecture, we already have discussed about bones and its parts. So epiphysis is a rounded end part of long bone that helps in joint formation and growth. It is present at both ends of long bones, okay? And it is mainly made up of spongy bones, which is also called as cancellous bone. And it's responsible for increase in length of bone during growth. So main function of epiphysis is to increase the length of bone during growth phase, okay? And also epiphysis contains ossification centers, okay, which is a secondary ossification center present after birth. Then let's discuss what are the types of epiphysis with their examples, okay? So the first type is pressure epiphysis. With the name, you can understand the function of pressure epiphysis is weight transmission. Okay, it is present at joint formation and articular cartilage is also present at pressure epiphysis. Okay, so for example, its examples are head of femur, humerus, lower end of radius, and femur, proximal end of tibia. While the joint is formed, the body weight should be transmitted. Na? So the pressure epiphysis helps in transmission of the body weight. Only in some bones, which are long bones like head of the femur, humerus, head of the humerus and femur, and proximal end of the tibia and lower end of radius and femur. These are the examples, okay? Then the next one is traction epiphysis. So in traction epiphysis, it is present at the site of muscle attachment, okay? And they do not take part in joints. So traction epiphyses are not present at the joints. They don't take part in joints, but they get pulled by muscles and therefore they create a traction. So you can understand this is a femur, and at the end of the femur we saw there is pressure epiphysis, and when there are greater trochanter and lesser trochanter, there are muscles attached. While doing movement, the muscle gets pulled and this muscle is attached to this epiphysis, which is present at the greater and lesser trochanter. Okay, so it creates a traction, therefore it is called as traction epiphysis. So it is present at the greater trochanter, lesser trochanter, tibial tuberosity and mastoid process. The third one is atavistic. The atavistic represents bones that were separated in evolution. So it has evolutionary history. For example, it is coracoid process of scapula. So this curved bone which is present in scapula, it is called atavistic. It represents atavistic epiphysis, okay? And os trigonum, accessory bone behind the talus. Okay, this is the os trigonum, which is accessory bone behind the talus bone. So the next one is aberrant epiphysis. Aberrant means not always present. So it is accessory or extra. It is not present in every individual. It is an extra bone which is present in only few people. Okay. Aberrant epiphysis is present at the base of first metacarpal and head of the fifth metatarsal. Okay. Head of fifth metatarsal. So these are important examples and many times it is asked in exams also, okay? So you can see base of first metacarpal. This is the first metacarpal and it is the base, and it is an example of aberrant epiphysis, which is extra epiphysis. Then the next one is compound epiphysis. Compound means formed by more than two ossification centers which fuse to form one epiphysis. So usually there is only one ossification center in one end, no? That is in one epiphysis. It means for long bone, for example, for long bones there are two ends. So two epiphyses are there and each epiphysis is having only one ossification center. But in case when there are more than two ossification center comes and fuse together and they form one epiphysis, it is called as compound epiphysis. So its example is lateral malleus of tibia and ischial tuberosity. Okay, you can see here This is talus. This is lateral malleolus of the fibula, and it forms compound epiphysis. This is example of compound epiphysis, lateral malleolus of tibia. Then ischial tuberosity is also an example of compound epiphysis. So these are mainly 5 types of epiphysis which are important regarding your exams. Then for clinical importance, you can see if there is injury to epiphyseal plate in children, it can cause growth disturbance, because epiphyseal plate is having ossification centers which are present after birth, and therefore if they are damaged, then the growth will be disturbed. Then the next one is epiphysis helps in age estimation in forensic medicine, because every bone in forensic medicine, you will come to know about it, that every bone is having ossification center which has separate timeline. Okay, they have different timeline to get ossified. That's why it is important for the age estimation also. So this topic is very important, so you need to understand all the types of epiphysis, and its examples are very important to remember. So this was our small topic on types of epiphysis. Watch it till the end and like it and share it with your friends. Bye bye.